Okay, so I will say good evening. This is the Board of Health meeting on Monday, August 5th, 2024, and we'll bring this meeting to order. Okay, first on the agenda, we got bills. Looks like everybody signed the bills. Fabulous. We'll get those back to Lori. And then if everybody wants to take a moment and review the meeting minutes from July 15th, 2024, as Lori has so nicely prepared for us.
I will make a motion to accept the meeting minutes date of
Right on the top of
August 5th.
no,
No,
July
I'm sorry.
15th.
Where's that? I didn't get that.
It's second.
Oh, here it is. I'm sorry. July 15th, 2024, as presented.
Second.
All in favor?
Aye.
Aye.
Present and not voting.
President not voting, so we think you did
weren't
this
here.
beforehand. Oh, you weren't here.
I can't vote on them.
Okay. Okay, so it's 3 and 0 and 1. Thank you. You're welcome. Okay. And we can start with our discussions.
Yeah, we don't have much, really.
Okay.
So nonprofit fees, when we talked about the food establishment, we're just doing $50 across the board for everybody. Just want to make sure that we can include the baseball. What do you call it? The baseball concession stand.
The concession
Yeah.
stands all goes back into the school.
Yeah, so I figured that's a fair thing to label them under nonprofit. They're not doing it for profit. They're just covering the cost of their concessions. If that's agreeable to everybody, I just wanted to confirm that that would fall under
It would go across baseball, football, all
you know, whatever
sports.
that, whoever's in that concession stand.
Okay.
Going forward, will just pay $50.
Do you need a motion to that effect?
We do.
I move to make the nonprofit permit fees $50 across the board,
Including the concession
Concession
stands
stands
at
for
the,
including the concession stand in any
Yeah.
nonprofit organization.
Perfect.
all in agreement?
Aye.
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 All right, and then, other topic of discussion would be to implement a fine for operating without a permit. So I can't find anything on the books on previous regulations that say that we have a fine for this. But we probably should have a fine for this. It came to my attention that we had a food truck operating who knowingly didn't have a permit. And so obviously it's done and over with now, but going forward, it would be, I think, helpful to have a way to enforce that you are operating without a permit. And it feels like at least 1.5 times what you would have paid if you paid the permit.
I'd say double.
Fine with me. I was trying to be diplomatic. You know me, I think if you hit people in the pocketbook, then people follow the rules. Because where was the consequence? He made his money, it's gone.
Yeah.
I can't do anything about it now.
I move to make the fine for operating without a permit double the cost of whatever the permit is they do not have.
Whether it be, so is that covering all our permits across the
Yes.
board?
Yeah, I mean, I think that that's fair because everybody's, all fees are different.
Well, I'm thinking, in my head, I'm going trash haulers.
Yep. Trash haulers, septic haulers,
Septic.
installers, disposal construction work permits, food trucks, food establishments. I'm sure.
Camps,
Camps,
pools.
yep, because we had the issue with the camp. I think it needs to be fair across the board and not limited to one segment, because that wouldn't be fair.
So double the fee.
But do you think this should be a warn you once?
Well, you can,
Fine the second
that's separate to establishing a fine. If you want to have okay, I'll make it easy. I make the motion that the operating without a permit is double the cost of whatever the permit is that is missing. It commences with a warning
I would argue about that. Because there is not one business owner in town or out of town, this was a food truck specifically belongs to the South Shore Food Truck Association. They are all very well versed on the requirements of permitting in every town.
I'm thinking of that camp.
Yeah, who's been operating for 30 years without paying for being a camp on town property.
Uh-huh.
Yeah, which
Okay.
the mass regulations, if you Google camp requirements come up.
Okay,
Yeah,
okay, okay.
so I just don't, I feel like you're gonna own a business, it's due diligence, you should know
I
what,
should know what
and
need
you
to
can
do.
call and ask a question.
Yeah.
We're here, we get plenty of calls.
Well, the board.
Yeah.
The board, this board has the ability to waive a fine if it finds extenuating circumstances or undue hardship. That's within our purview.
Mhm.
And so I withdraw my motion. It didn't get a second anyhow.
I'm sorry, I started talking before we had a
Yeah.
second. Thank you, Dennis. You want to redo it?
Yeah, the motion is to establish a fine, if you operate without a permit, you will be fined double the cost of whatever the permit is you do not have.
Second.
Second. Sorry.
You guys are very efficient tonight.
All in favor?
Aye.
Aye. If anybody wants to have discussions after these things, please speak up.
Yeah,
I
I mean,
forget to
I
offer
don't
that.
expect, I didn't expect it to proceed so quickly, I thought we
That's fine.
have.
How about those Red Sox?
Well, you know, I'm trying to make it so that we get in line with, towns around us, and I think by doing so, it's much like the cigarette thing, when we're all in lockstep, it makes it that much harder for people, because people know where the lax areas are and choose to, if they're gonna not do something, they're gonna do it where they're less likely to get in trouble.
And Joyce, do you have a health agent report for us?
Yes.
Beyond, what do we got?
Yeah, I mean, the pending properties are still pending, 48 Evergreen. I have signed off on their revised septic system, so, I believe that's still currently in the planning stages with building, but we have signed off on it. All plans are in order, it meets requirements. I did contact DEP to confirm the increase in flow given the facility use, and so that was redesigned to accommodate what the DEP said should be. So, that will probably be a go. Nothing new on the Wapping or the 60 Country Club.
Okay.
Wells, the Pottle Street loans are in progress. We had a new application today. It's not completed, but somebody else has, got one going in on Nava. That went through with no problem. New one came in today. Complaints, we've had a couple over the last couple of days. The Kingston collection, I've had 2. However, after speaking with management, one of the complaints is probably related to some mental health stuff that's going on.
Okay.
And so it is being addressed. The management's really doing a good job of working with the housing company that's the housing agency that's involved with this person to work on that. The other one is just the guy keeps getting spider mites, and the collection is doing all the proper things. They have all the exterminator
Yeah, they've had
paperwork.
quite a few exterminators coming through.
Yep, but they're doing the right thing, and some of this may have to do with just people's level of cleanliness and what everybody's has varying ideas of how to keep your house, and so that may be contributing to it, but it is under control. I was impressed with the management company. They, taking these things seriously. It's very different from the previous management company, because now it's the point, so
Okay.
they've been very receptive. Treetop condos, there was an issue with the pool that's been resolved. And then I got a call about mold, but it's the person owns the unit. So, and there's nothing to cite for mold. So I've just directed them that they should really be in touch with the condo association, and that's something, they are the owner of the property. And then I left messages, I haven't heard back from anybody, so I closed out that complaint. The ongoing for Spring Street, I will be contacting Housing Court to bring that forward as a court case because many of the repairs have not been done and the resident has provided documentation of that the owner is requesting that people fix stuff and sign leases. It's very convoluted. So I've suggested that they get in touch with Housing Court and I will just be following up with the Housing Court concerning the lack of movement on fixing the issues that need to be corrected.
That's a landlord's responsibility. isn't it?
Right, I know. 1012 Bagnell, this is a neighbor dispute about pigeons. I have met with both parties. I have been
Pigeons?
out to the property on multiple occasions, I think 4 altogether, one at 6 o'clock in the morning so I could witness the pigeons. And the problem is they were all cottages at once, at one time, and now one of the houses has been rebuilt and it's beautiful, but it's also tall. And so pigeons roost on the highest point, which is no longer the telephone wires. And so I've had conversations with both parties. I sent, I call them rat letters there to the neighborhood, 3 streets, 20 people, so that nobody was targeted individually to say, these are the things that you can do to help at least limit the nuisance of rats. I got one person saying they saw some, I have been there, I have seen no rat holes. I have seen no evidence in that area. I'm very well aware that there's rats, it's the wharf, basically. But I did not see anything on the properties. And so I've instructed both parties that the Board of Health, the Health Department does not get involved in neighborly disputes. If there is a nuisance, I will cite for that. And a correction order will issue for whoever the party is that has created the problem. But at this point, I didn't find any evidence of anything to cite. There's bird seed, but there is not, again, I didn't see any evidence of rats, and I can't cite for pigeons. They are there. They apparently been there for 30 years. Not probably those pigeons in particular. I'm sure they're.
I don't know what the.
It's an
like,
ancestral-
Pigeon, I'm not sure.
Not long,
Oh, yeah.
a year or two. They're not like a lengthy bird.
That's
But
interesting.
I'm sure, you know, like, it's like anything else, they go back to where they, you
Came
know,
from.
yeah, so, hopefully that will, after discussing it with both parties, hopefully, we will see a dissipation in the hostility, because I've made it clear that
We're not here to do
I'm not a
neighbor disputes.
negotiator. And then 8 Gray Ave, there were some trash complaints, I've gotten to speak with the wife of the person that owns the property. They are currently in some domestic issues, so there's also possibly some other issues related around this, and so neighbors are willing to help out, and the wife, who's no longer living on the property, is gonna try and get a dumpster and make some movements. So I feel like if we just are a little patient with everyone, that situation will be rectified as well.
Oh, good. Nice of the neighbors to be helping out.
Yeah, I was really impressed with the 2 men that I spoke to. One called the complaint in and, you know, was very nice about it. And then the second neighbor that called was like, you know, hey, I got a truck. So I've spoken with DPW, and if at some point, if the dumpster thing doesn't work out and neighbors are getting involved to help haul stuff away, I've spoken with DPW and the town administrator, and they said it would be fine for us to waive the collection fee to be able to get this picked up, because it's sort of a compassionate care kind of thing.
Yeah.
And then I've also been to Pembroke Street today. That is a work in progress. So as things progress, I'll let everybody know. But I was just there today. We've continued inspections. Our grant inspector is on vacation. She's away for a little bit, so I'm just picking up what needs to be done. She's very efficient and was actually a little ahead of a schedule, so which is good for me. I've done a couple of truck inspections. And, you know, I will continue to complete them as needed as they come in. Trainings and meetings, we had our grant committee meeting, I believe that was last week, and, same with the Plymouth County Mosquito Commission. I was there. We are doing something at the library, the library in the kids' room is running a program, so that when fire come in, they're having police come in. And they asked us, so I actually am gonna be at a doctor's appointment, so Laurie's gonna go in and do some stuff around, you know, safe food practices, handling practices, how do you wash your hands, like what are some safe things, if we're cooking, so we're really nice and simple stuff, but a good way to sort of get what we do in this department out to maybe a younger group. So that
I'm sure they are gonna be absolutely intrigued, Lori.
I know, and I think it's
I'm
gonna,
already trying to plan my board route.
I was gonna say, it's gonna be great. I love it.
it'll be smashing,
Yes.
but I'm really
Yeah.
psyched that Lori's gonna get to do this, cause I have,
If you need any help with that, I'll be more than.
you know, it'll be great. So we're working on what we're gonna present and the librarian's super to deal with, Kat,
Yeah.
she's fantastic.
She'll help you gear it for the right ages. in the
Yeah.
room.
And then, under septics, and I had Charles Drive, 10 Forges under the wrong thing, sorry. I'll get to that in a minute, that's sort of under complaints. But I've done a few septics, Title V, I went out and re-witnessed another Title V, which in fact is in failure. Had a lovely discussion with the homeowners, they were super nice. So hopefully they'll be taking advantage of the betterment loan. They're in the process of selling, so we'll see what happens with that, if they need to or not. I've completed 2 nursing interviews. Both candidates were very nice. One, would be great, but she also works hospice, so her availability may be the issue. Sorry. So I'm waiting to hear back from her to see how she, you know, what she feels like she can accommodate. The other person we really liked, but were not sure that it would be a good fit. She was kind of looking for a little bit more guidance than I would be able to give. She comes from more of hospital settings, and so not really public health minded, although she's interested in it.
I'm happy to look over those resumes with you.
Yeah, no problem. And I'm wondering, like, I know we took, right now it says a bachelor's degree. Do we feel like opening it up to associates with
No.
multiple years? No, okay.
No.
That's why I'm asking. I'm like, I am at a loss
No,
to try
because
to get people.
When
to
you
apply
get
for
into the
this.
public health realm, you're getting into a lot of studies and other factors that you need your
Wouldn't-
bachelor's degree
right.
to
Okay,
complete.
no,
It's
that's fine. That's why I'm asking.
Yeah.
I'm at a loss as to
how to get people to.
where
apply.
else to host this. Tina has it on Indeed, I believe MHOA, MMA, but I have to stay on it to get it re-upped.
Yeah.
So, I would rather, we have 2 grant nurses now, which is phenomenal. The one that is covering for our town is super. She's already started to integrate into the COA, I think. Right, so I don't feel like left without anybody.
At least we have something to help fill some
Right,
of the
yeah,
void.
yep,
at the
they're
time while we're
keeping up with Maven, they're doing the clinics over there, so I feel like at this point, I would rather stick with that than hire the wrong person.
Because we are seeing another surge in COVID-19.
Yeah, I just ordered tests today. Whether they come in or not, I keep ordering, they just don't get, I don't get them.
Okay.
And then on top of that, they have a 60-day window is what the,
We're
Makes
just,
sense.
I'm is thick right now.
and
Not
I've
as
also,
many people ending up in the ICU setting
Right.
with it, but
But
people are
it's
still
still
ending
pressure.
up hospitalized and needing oxygen.
Yep.
You know, it's definitely not where we were years ago.
yeah, but we don't want it to get back. there.
Yeah, I mean, luckily we've seen the flu dwindle down.
Yep.
But we're getting ready to get back into school again.
Yeah.
And we probably need to get in touch with Big Y.
I've already done it.
You are fabulous.
Oh, I don't know about that, but, I'm waiting, because Glenn's retired. I met the stand-in, who is currently covering, because is it Christine is the other person that was under Glenn? Whoever,
Lisa?
I don't know, one of them was out on maternity leave.
Oh, definitely.
It's-
Lisa, I think is older.
Yeah, it's the one who she just had a baby.
Okay.
Yeah, she's out on maternity leave, and so I spoke with the interim one, who was very nice. She took my information, she's gonna pass it along to a lady named Elaine, who is kind of in charge for Big Y for orchestrating clinics. So I'm thinking one in September, one in October to kind of catch anybody who forgets. And so as soon as I hear from them, I will let you know what dates are set.
Okay,
And
and
so
we're
we can
asking them
start
for
advertising.
flu, COVID, and pneumonia.
We can't, I'll ask them for the
Those-
world. You
those-
Just tell me what you
yeah.
want, and that's what we'll
Those
ask.
are your three big guns.
Okay,
You should have all three of those. You should have all three of those.
okay, well, as soon as I hear back from them, I will let you know.
Yeah.
What the dates are gonna be, so we can start getting paper, flyers out.
Get a meeting room or a
Yeah,
place.
I'll have
situated.
everything organized. I think the idea of doing it over here worked out well.
That little room in the front worked out great. We were
Well,
able to.
the other thing is that it becomes a logistical nightmare trying to set it up with COA because of programming, and I just think, this worked out really great.
Yeah.
We did it in the big room.
Yeah.
Yeah, we did it upstairs.
We
so-
did it upstairs and downstairs before. You know,
Oh.
the first room on the right,
Yeah,
we did, what did we do there? But we were able to fly people through there because it's right there by the entrance.
right.
So you didn't have to worry about getting people who weren't as ambulatory up the
Yep.
stairs. So that's actually a really good room to do,
Okay,
just saying.
It
Those
was
who need it.
small.
because they had two clinicians the last time they came. They were,
Yeah, you just put them on either side of the table and you just run people through.
okay, all right. Well, we'll look at, what, if that's an option, gladly grab that.
It takes, I mean, it leaves the bigger rooms for different stuff.
So that's pretty much
What's 10
I was
Forge Road?
gonna say 10 Forge Road.
that,
Is that the abandoned house?
Yeah, so, long story short, I had a conversation with the son, of the people that owned it. The mother has passed away. The father, is just not involved for whatever reason. So the son has moved back. He said he was out in like Colorado or Arizona. So him and his wife, are renting somewhere right now, but they're fixing up the house. So little by little, they've started to get, and one of the neighbors, when I reached out to one of the neighbors who had originally made the complaint, said, oh yeah, I saw the dumpster there, they're working on it, so.
Okay.
I don't feel like there's a need to issue an order as that they're really working to get it cleaned up, and he's working a full-time job and doing this on the weekends, so. Said, that's fine,
A
I'll
work
try.
in progress is a wonderful thing.
Exactly, and like, why make more strife if there
Right.
doesn't need to be? I'm sure it's
Sure,
already hard
stressful.
enough, so that was it for the 10 Forge Road.
I like that. Do we have have we received any information in terms of cooling centers and stuff like that with this,
Well, they put it out on the town website, that they're using the COA as our cooling center.
Yep, and
just
they
put
did it
out.
in reverse 911
yeah,
with the last heat wave.
okay. And the other question is, not for this
I think
meeting.
that's coming through emergency
I think
preparedness.
it's Mark
It's
and
not
Adam.
really through us, it's through emergency services.
I mean, because this summer has been absolutely savage. I mean,
Yes, it has.
I have central air in my house and they can't keep up with the heat. The basement is like 10 degrees above zero and the rest of the house is like 85. What about, I've been reading a lot online and through news apps about a lot of mosquito-borne illnesses that are now beginning to show up.
Yes,
because-
as you can see, we have the billboards out front.
Yep.
I get weekly, if not more, updates. So currently we've had positive tests for both, Triple E and West Nile. West Nile is still considered a low risk at this point. Triple E is at moderate, which is why the sign is out there. So, we're just monitoring it. As the risk goes up, the board will change.
Okay,
And we're posting results on our website, Facebook, We're also doing the water quality testing. We closed the beach, was it 2 weeks ago, last week? Whatever, for a couple of days because the levels were so high. I was able to open it. I had a plan in place to reopen it on Saturday if the lab called me to tell me it was good. They did, so I called Sue. Sue had her staff open it, so it worked out well.
I
But we have
appreciate
stuff
that,
in
Yeah.
place.
because a lot of people, that's what they use for
Yes,
cooling.
exactly.
Right.
Yeah.
Okay. So
If there's
that's-
nothing else, I'd make a motion to adjourn.
Could I suggest that our next regular meetings will be scheduled for August 19th, 2024, being the third, we're getting back on our first and third Monday
August
schedule.
19th. All right.
It's right on the bottom of the agenda.
Yeah.
You know.
No, it's good. And if there's nothing, we'll let you know the week before if we don't, it's been
Quiet.
quiet-ish, you know, so we'll
Oh.
see.
Hopefully it'll continue.
I would
Yes.
like to second, can I second?
Yeah.
Even though I'm running it, I'll second his motion to adjourn. All in favor?
Aye.
Thank you very much, everyone. Have a wonderful
Yeah.
evening.